Before Contrave, I remember I would plan my food, I would plan my week, I would meal prep all the things that I needed to eat, and then just something would happen and it would just spiral out of control. I am Alicia, I'm 35, born and raised New Yorker. I work in the events industry. I enjoy spending time with friends, going dancing, going clubbing, and sitting at home and reading a good book. I grew up always on the bigger side as a kid. It's always slightly thicker, big boned, and that really continued into adulthood. Contrave really allowed me to stick to all of these great weight loss programs and plans because I wasn't being overpowered by my cravings. Healthy habits fuel my weight loss, and Contrave gave me the power to create healthy, sustainable habits. I could get back on my bike. I could spin again. I could walk again. I could do yoga. Now I'm like, let's try the Pilates, let's explore. And I could do it at my pace. There's no quick fix. There's no magic pill. There's no super instant solution. I wasn't being controlled by my eating anymore or fighting myself an uphill battle. Contrave gave me the power to move forward. Contrave gave that power back to me.
Contrave can cause serious side effects, including suicidal thoughts or actions. One of the ingredients in Contrave is bupropion, which has caused some people to have suicidal thoughts or actions or unusual changes in behavior. If you already have depression or other mental illnesses, taking bupropion may cause it to get worse, especially within the first few months of treatment. While taking Contrave, you or your family members should pay close attention to any changes in mood, behaviors, thoughts, or feelings. Stop taking Contrave and call a healthcare provider right away if you or your family members notice any of the symptoms listed on the screen, especially if they are new, worse, or worrying you. Contrave is not approved for use in children under the age of 18. Do not take Contrave if you have uncontrolled high blood pressure, have or have had seizures. Use other medicines that contain bupropion. Have or have had an eating disorder called anorexia or bulimia. Are dependent on opioid pain medicines or use medicines to help stop taking opioids. Or are in opiate withdrawal, drink a lot of alcohol and abruptly stop drinking. Or use medicines called sedatives, benzodiazepines, or anti-seizure medicines, and stop using them all of a sudden. Are taking or have taken medicines called monoamine oxidase inhibitors in the past 14 days. Or are allergic to any of the ingredients in Contrave. Tell your healthcare provider about all of your medical conditions, including if you have any of the ones listed on the screen. Tell your healthcare provider about all prescription and over-the-counter medicines, vitamins, and herbal supplements that you take. Contrave may cause serious side effects, including seizures. If you have a seizure, stop taking Contrave and call your healthcare provider right away. Do not take large amounts of opioids to try to overcome the opioid blocking effects of naltrexone. This can lead to serious injury, coma, or death. Get emergency medical help right away if you experience any symptoms of opioid overdose. People who take Contrave must not use any type of opioid or opioid dependence treatments for at least 7 to 10 days before starting Contrave, because it may cause you to suddenly have symptoms of opioid withdrawal, which can be severe. Tell your healthcare provider you are taking Contrave before a medical procedure or surgery. Stop taking Contrave and call your healthcare provider, or go to the nearest hospital emergency room right away if you have any symptoms of a severe allergic reaction. Your healthcare provider should check your blood pressure and heart rate before and while you take Contrave, because it may increase your blood pressure or heart rate. Stop taking Contrave and tell your healthcare provider if you have any symptoms of liver problems. Bupropion can cause some people who were manic or depressed in the past to become manic or depressed again. Talk with your healthcare provider to find out if you are at risk for angle closure glaucoma and need treatment to prevent it. Because of an increased risk of low blood sugar in people with type 2 diabetes who take medicines to treat it, you should check your blood sugar before and while you take Contrave. The most common side effects of Contrave include nausea, constipation, headache, vomiting, dizziness, trouble sleeping, dry mouth, and diarrhea. Contrave is a prescription weight loss medicine that may help some adults with a BMI of 30 or greater, or adults with a BMI of 27 or greater with at least one weight-related medical problem lose weight and keep it off. Contrave should be used with a reduced calorie diet and increased physical activity. It is not known if Contrave changes your risk of heart problems or stroke, or of death due to heart problems or stroke. It is not known if Contrave is safe and effective when taken with other prescription, over-the-counter, or herbal weight loss products. Contrave is not approved to treat depression or other mental illnesses or to help people quit smoking.